Good evening, Shreya.
Good evening, sir. Waiting for ma'am to join.
Okay.
Hello.
Hello, good evening, ma'am.
Very good
Good
evening, ma'am.
evening. Hi, Dr. Kinnoor.
Good evening, ma'am.
It's my pleasure to be conducting Residency Talks Instagram live session along with Dr. Kinnoor Das, sir, and I'm very elated to have you here, ma'am. So, just for our viewers, as an introduction, Dr. Savitha, ma'am, is the honorary treasurer of IADVL. She is also the vice president of IADVL Karnataka and the co-editor of the recent fifth edition of the IADVL. She is also a professor at the Department of Dermatology at Saptagiri Institute of Medical Sciences, Bangalore, and the consultant at the Roots Institute of Dermatology, which is, I think, very famous for the dermatosurgery and the fellowships. So she is also, worked a lot with the journals and is an assistant editor of Journal of Cutaneous and Anesthetic Surgery and also the Clinical Dermatology Journal. Other than this, I think most of you have not heard about the Nail Society of India. So ma'am is in the executive committee of that as well. So we are very happy to have you here with us, ma'am. Thank you for your time. Kinnoor, sir, can
Uh,
you proceed?
yes, and without taking much time, we will start with our questions. So, ma'am, the first question from my side would be, what was the thing which inspired you to join the medical field?
Hello. I think I lost half of the question.
Ma'am, what was the thing which inspired you to come
Oh,
into
to
the
join
medical
any
field?
medical field. I think during those days, we had only two options: do medicine or engineering. So gave my CET, and then medicine counseling was first. I got into Bangalore Medical College, and that was it. And I did not attend engineering counseling after that. So that's how.
And why? What was the reason you selected after the MBBS? Means
My
the dermatology, the field of.
dermatology also was by accident, not by choice. Wanted to be in Bangalore, wanted to pursue something in Bangalore. I had taken psychiatry in Nihant first. Then through All India, when I attended the counseling, dermatology was there. So I just took that up and then I thought I'll decide what to do. But then once I came, visited the department and decided to continue with dermatology after that.
Ma'am, in the residency, I mean, since we have residency talk, the first question would be regarding residency. That what was the most memorable part regarding your residency days?
Hello.
Yes, ma'am, you are
Ma'am.
audible.
Yes, sorry. What did you ask?
Ma'am,
Sorry.
what was the most memorable part of your residency days? Any
Oh,
incident or
residency was
anything?
fun. No, residency was fun. We made good friends. We had a very, very cordial department, a very happy department. Dr. Dinesh was with me. And our teachers were very good. We had Dr. Sachidanand sir as our HOD. So many things. It was basically a lot of fun. Our very enjoyable 3 years, a very, very good 3 years. I've heard many of my juniors come and tell how residency is very difficult and they've had tough times. But we've been very lucky and we had a lot of fun over those 3 years. We studied also, but yeah, we attended almost all conferences, almost every conference which we had. Sir always encouraged us to attend. So those conferences were like along with trips and yeah, that was good. The majority of my academic thing I started doing only after my residency. So during residency was just.
Ma'am, any memorable incident of your residency days?
It's difficult to say one thing actually. I'm just not able to recall one any specific thing like that.
Okay, ma'am.
Ma'am, what was your residency like? Was it only the medical dermatology or you even had dermatosurgery in it?
We had
Or
dermatosurgery and aesthetic. Bangalore Medical College was the first place to start an official university recognized 1 year fellowship program in dermatosurgery. So that started in 2006 January and I joined in 2006 June. So that was the first batch and they had started all dermatosurgical procedures there. So we got to do a lot of things. We as postgraduates were posted there. So every third month, we used to have 1 month of posting in dermatosurgery OT. So we got a lot of exposure. And because fellowship students, it was new for them also, they let us do a lot of things. And when the new batch came, we would know a little bit more than the fellows. So that in that time when the fellows used to get used to the routine, we used to do it. So dermatosurgery was like part of the curriculum. From first year, we've been doing hair transplantations, all vitiligo surgeries. So all of that, it has come along with medical dermatology for us. So the orientation was there since the beginning for us.
so, ma'am, when was the time that you developed interest in dermatosurgery? Was there a separate time or any incidents that inspired you to take up dermatosurgery?
Special interest came only after my post-graduation. When I was doing post-graduation, we had to do it. So it was part of that. And then when I joined as a senior resident, yeah, that is when I developed interest there. And then after 2 years, I decided to pursue my fellowship in dermatosurgery there. So when I was there, I used to see these things. And yeah, that's when I decided I'm going to do dermatosurgery.
That's so great to know about you, ma'am. Ma'am, can you tell us about the fellowship options for someone like who has just done with their residency? Where can we look for such options? What options are available for us in India, outside India? Can you please enlighten us on that, ma'am?
Yes. So fellowship in various. We have dermatosurgery, we have aesthetic dermatology, we have dermatopathology fellowships which are there. So in India, or at least in Karnataka, and also few places in Maharashtra, you have university recognized a 1 year fellowship program where exclusively you're trained for a year. So most of these are based on interview. It happens once a year. Their university websites are usually publish these things. So you go and you attend it. So that is one thing. Other than that, there are a few centers which offer like a observership program for 2 to 3 months. So you can do that. Even IADVL offers these observership programs which are of 1 month duration and 3 months duration. So that is what you can avail. If you do not get the 1 year fellowship, you can actually do these 1 month courses, or if you're not sure what you want to do. So you could probably do a 1 month course, and then during that time, if you realize that you actually like these things, like for me, aesthetic dermatology, it's very, very difficult for me to do aesthetic dermatology. You tell me Botox and fillers, I'll be blinking. And somehow I'm not interested in them. So you need to spend some time and realize to get to know if you're actually interested, and then you can pursue a fellowship further. So that is one. Abroad, Singapore offers some courses, but more in aesthetic dermatology, not dermatosurgery. And yeah, this is what I'm aware of. I'm not aware of other places. But there are many consultants and who will take you in for a month or for 2 months as observers or as junior consultants if you're interested to do it, and then you can pursue your interest and stay with them for some time and learn the procedure.
Thank you, ma'am. So just to summarize what you said, there are observerships which the recent graduates can look for. Other than that, there can be 1 year fellowships offered by University of Maharashtra, the MUHS, or even in Karnataka. And other than that, maybe something related to aesthetics in Singapore. So these are the options that we broadly have with us. So ma'am, which are your favorite procedures in dermatosurgery?
Favorite, I like to do the vitiligo surgery. Vitiligo 1, they're very, very gratifying. Or maybe probably they're not so much aesthetic. And the amount of, the patients are happy with the results, they're genuinely happy. When you're doing an aesthetic procedure, the type of counseling which you need to do for the patient and patient's expectations is completely different. But when you're doing a dermatosurgical procedure, it's more of therapeutic. Example, if you're doing nail surgery for an ingrown toenail, you're giving so much of a relief to the patient. It's mainly therapeutic. So the type of patients which come asking for both these categories are completely different. But in dermatosurgical procedures, vitiligo surgery is something which I really like to do. And other than that, it's the nail.
Okay. Which one do you think is the most difficult dermatosurgical procedure for you?
Difficult, I wouldn't say
or maybe
difficult,
it takes time
hair transplantation. It's a very laborious job. It takes 8 hours. It's back-breaking. It's very tiring. And then patients don't get results immediately. So post-procedure follow-up is going to be like really long, counseling them, lot of hand-holding. They see results only after 4 to 5 months. So though we have counseled them before the procedure, all this is there. In spite of that, by first month, end of first month, patients will start no growth, no growth, no growth. So hair transplant, I find hair transplant to be very difficult. It's the days I have hair transplant, I'll be like, hair transplant today. Okay? So
yes, very true, ma'am. So how do you keep your, Dr. Somi has asked this question, how do you keep your interest in academics alive? How do you keep yourself updated? You have so many roles to play. How do you keep yourself just updated with everything?
I'm in a medical college. So when you're in a medical college, we have seminars every week and postgraduates are always presenting. So when a postgraduate is doing a seminar, you learn or you relearn and revise what you already know, and there's always something new which you're learning. One. Second, conferences, I attend so many conferences. So every conference, you're learning something new. I do read a lot. I spend a lot of time reading. So I don't shy taking my book out when the patient is in front of me and referring also. It's okay. So when there is a doubt, I ask the patient to wait. I'll just refer and I'll see what, or I'll Google sometimes and see. Even for therapy, I do search and see what else can be given to the patient. So I think reading and attending conferences in general will help you keep it updated. And interest in academics, it's more personal, I think. There are few people who get into practice and don't want to read and are happy with what they are doing, which is also fine. And if you're interested, you'll always find ways to do it.
Yes, ma'am.
Before
Ma'am,
that,
yes, sir, please
we have two more questions regarding this. We have two similar questions: that how to practice in a multi-specialty hospital if we don't have our own clinic or setup, and we had a similar question: and any tips on starting practice when we are fresh out of residency? I think it would be a question for many of our viewers.
Yes.
Yeah. I think if you decide to get into private practice, you need to start off. There are many people who think you need to go work with seniors and then get confident and start. But I think you need to start. And as you're doing, you learn few things. Yes, what you do in your residency and what you practice is a little different. But you still learn, and you can probably start your clinic half day and then spend the first 4 or 5 months just working and observing other seniors or your colleagues, and you learn something new from everybody. In every other clinic or any other place you go, they have something new to offer. So you spend some time learning them and how to manage the clinic and all such things you can learn from them. And in 6 months or so, your practice also will pick up and you can expand it whole day. Or join a medical college in the morning and start clinic in the evening. That's also an option. Or multi-speciality hospital also. So advantage with multi-speciality hospitals, everything is taken care of. They give you patients. If you have to do a procedure, there's a nursing staff who is there. You don't have to break your head so much as and when like you're in the clinic. In the clinic, you have to hire, you have to maintain the staff, you need to see what to buy, what machines, all that. But in the multi-speciality hospital, these things, the infrastructure and other things are taken care of, like paying the electricity bill or paying the rent. All these small things you don't have to take care of when you're in a multi-speciality hospital. But I think ultimately, if you're going to be in private practice, having your own setup and practicing full-time in that is what will give you the satisfaction.
Thank you, ma'am, for your views on this. Ma'am, which is the book that we should refer as residents or just people like me who have just graduated for dermatosurgery?
For dermatosurgery, this textbook by Dr. Satish Sawant and the ACSI textbook. These two are pretty standard books which cover. Both books are good. Dr. Satish Sawant's book has more on the I think the new version costs dermatology also. I'm also currently reading it. I just got my copy and I'm reading the new edition. And the ACSI textbook. I think these two are good enough.
Okay. Thank you, ma'am. So, ma'am, my another question is, like, as an assistant editor of JCAS, like, what is your advice to residents about submitting articles, and what do editors expect from such articles? Which are the articles which get just rejected within, like, we sometimes get rejections within like 2 days, 3 days. Sometimes it goes into the peer review.
See, if your article is something which is already known, if you've done a work which is well known and it's already there, then obviously it's not going to get accepted. But if you have done a study or a case, a report or a case series of even a common condition, but a collection of a large number of cases will get accepted. But one thing, when you're submitting to the journal, other than the content, please take care of the language, the grammar, and the spelling mistake. See, this is something because when I start reviewing, if there are too many errors, I get lost in correcting those spelling mistakes and the grammar, and I kind of miss out on the content. It's very distracting. But if your article is well written and you don't have to have a very hi-fi English and use big words, simple language, small sentences, keep it crisp, make sure that the message is conveyed. So whenever someone is reading the article, the message has to be conveyed. So if it's simple language, well-written article, it need not be a lengthy one, that one, and the content. If you're publishing a case report, something which is not very common is going to get accepted, or a case series or a selection of cases. And original articles also have a better chance of getting accepted. And that's what. Don't give something which is very common or which is already published many times, or a similar article which is published in the same journal. Maybe something which is published in another journal can get published in a new journal if that topic has not been covered in that journal. But if it's the same, example, a comparison of cryo and intralesional for keloids. If JCS has published it, it's not going to accept the same. But a new journal or some other journal, the chance of accepting it is going to be higher. So, and there are so many journals. So any work you do, don't get disheartened if one journal rejects it. Send it to another journal. If you have done the work and if it's an original study, you've put in some effort in it and it is going to be good, and some journal is going to accept it. So if one journal rejects it, take in all the comments which were given to you, whatever the suggestions were given and why it was rejected, do the corrections, submit again, submit the third time, fourth time. At some point, it's going to get accepted.
Ma'am, I have a question. Means apart from the academics into the dermatosurgery, means how do you convince patients for a surgery or even a punch biopsy? Means when people are so afraid of blood and all. Means as a newcomer to convince them.
I think one what I have learned now is you need to be very authoritative. You tell them, see, this needs a biopsy and I'm going to do that. If you ask them, do you want to get it done and spend more time explaining these things, that's when they get confused. So you tell them, this is it, I think this is a thing and I'm going to do a biopsy for it. And yeah, they agree. But the more you explain the procedure, the more you convince, then maybe they'll think, okay, we don't want this, or at least biopsy, I don't find it very difficult to convince patients for biopsy. They usually agree. They do. A medical college, definitely no problem at all. But yeah, in private, yes, sometimes it is. They say no. Then we tell them, okay, fine, we'll start you on a medical line of treatment. Let's wait for 2 weeks or so and see. Or some conditions we tell them the treatment has to be taken for a long time. So it's always better to have a proof. Example for like in pigmentosis or some condition like that. I always do a biopsy because the treatment is going to be for a long time. And it's always good to have a record. And now considering the medical legal part of it also, it's always better to have something on record for the proof of the diagnosis.
Can we take one more question from the viewers that how to get job opportunity in private hospitals post residency, ma'am?
Private hospitals, first you decide where you're going to be, and then you just if it's a medical college, go around all medical colleges and give your CV. If there's a vacancy, they call you. Same thing in the hospitals. You go and give your CV. If there's a vacancy, they take you in, or if you have a slot, they take you in. I don't think there's any other way how you're going to get in.
And perhaps the question was means how to explore for these, means there are openings in all. Means many people are not aware of the fact that there's an opening at this place. Means any tricks or any website or any forum even.
Yes.
Hello, ma'am.
Am I audible?
Yes,
yeah.
ma'am.
Yeah. So what I did was I went around and gave my CV to all the hospitals around, and then we just got a call. So I think that's how. I am not aware of any websites or anything which is there.
The gist is we have to just begin with everything, means just submissions. Then everything will come in our way.
Yes, but just start off. maybe the starting is going to be a little difficult. Decide if you're going to be in medical college or in academics or in practice. If you're going to be in practice, my advice is start off immediately. Decide where you're going to be, your place, because if you're going to move very far, your patients are not going to move with you. Now, there are so many dermatologists available everywhere. So patients also will mind traveling. So you kind of decide which place you want to set up and start your practice there. It doesn't matter if there are many dermatologists around, your practice will always pick up. There's enough for all. So.
Ma'am, we have one question from the viewer. Do we get SR-ship recognition from a private hospital which is not a medical college?
No.
No.
SR is a teaching, it's a non-teaching. Actually, NMC says it's non-teaching, but it is only from medical college where there are postgraduates. So you don't. You get a junior consultant, I think, from a private college, private hospital, but you don't get these things. Somebody has asked books to follow in PG life. I am a diehard fan of Rooks. I read only Rooks, page to page. I mugged Rooks. So that's why I would say Rooks and Fitzpatrick. So I'm the co-editor for IADVL textbook. I feel IADVL textbook is more like a note. You need to read more things, and different topics are given well in different books. So PG, those 3 years is the time when you're going to study. So use that time to read whatever books are available. Maybe you can read one textbook in the end towards the exam and use it for revision and be familiar. But when you start studying a topic, refer to many textbooks. You can make your notes and keep. When you do this, you remember better. You get a better hold of the subject. The amount of time you're going to spend studying in your PG, you're never going to sit with a book after that. So this is the time when to use this time extensively to study. Study well during your post-graduation. Study medical dermatology during post-graduation. Dermatosurgery, aesthetics, everything can be studied after, can be learnt after. It's your basic dermatology which has to be good. If your basic is strong, then now whatever you do later, either aesthetics or dermatosurgery, whatever you do, that you will give good results. But have a very strong basic dermatology.
It's a very important.
Bologna is a good book. I did a little bit of Andrews, but otherwise, Rook was my go-to book.
Ma'am, can you tell us about the Nail Disorder Society of India?
Yes, Nail Disorder Society, I think, was started in 2010. I think it was started in 2010 or 2011, one of these years. So after that, in Bangalore, we did the first nail conference also. Nail Society of India is a smaller, it's a new organization. They have ONICO-Con every year, which is very good because it's exclusively on nails. So all the medical aspects, all the surgical aspects, everything. So during your residency, try and attend one ONICO-Con. So you get to learn lots. These focused conferences are very good. The take-home message you get from focused conferences is very high. So
that is one. Also, Nail Society of India offers scholarship if your thesis is based on nail. So if you have a thesis on the nail, then you can apply for this scholarship. And after that, also there are some prizes which are given, some scholarships which are given to attend conferences outside. So you can make use of all these things.
So, ma'am, how can we become the member? Is it via the website or is there some other application process for this?
Hello?
Yes, ma'am. Can you hear me, ma'am?
Yes. Sorry, I'm going in and out. Sorry, I missed your last question.
So ma'am, my question was, how can we become a member of this society? Is it
Nail
via the
Society.
website or?
I think, yes. NSI, there's a website for Nail Society of India. The application form is available there. You just download, fill the form, and you mail it. You get your membership number.
Okay, ma'am. So ma'am, thank you for enlightening us about this society. It was very new for me, I think, for most of the viewers as well. So the
Yeah, it's a
takeaway
small
point for
society.
yes, ma'am. So the takeaway point is that those who are like the first years have just joined now, and they can take use of this thesis grant award, which is there. So that's a very good thing, and also we can attend an ICON. So
It's happening
I
in
request all the
Visakhapatnam, first week of December, first weekend of December. So, look at it.
So I request all the viewers, if you have any questions, you can put it down now. This is the right time to ask, ma'am.
I hope all residents are members of IADVL, because IADVL also has lot to offer to the residents. There are a lot of scholarship programs. We have observership programs. So once you're a member, you will get mails regularly regarding this. So you'll be aware of it. If you're attending any conferences, international conferences, also you can avail the scholarships. For the national conference, you can avail scholarship. And in Dermacon, there's so many awards to be won. So all you need to be is a member of IADVL for it.
I think we missed one question. Somebody has asked, how do we keep your interest in academics alive? How do you keep yourself updated? I think we have taken up the question.
Yes, that's I answered.
Yeah, it's always studying and going to conferences, and ma'am is in the medical college.
So being medical college is just a bonus, but otherwise, continuous studying you can always do it.
Can you give some time management tips? That's very important.
Okay.
Like when we, working in a medical college, you're also working outside. How do you keep the balance of work and family?
Somewhere there's a compromise. I feel you can't do everything. You need to prioritize. Just decide what needs to be done and what is most important and what needs your time, and make prioritize. Have a chart. That's how it's going to be. See, when you're in a medical college, it's a fixed time, so you cannot do much there. You don't have flexibility there regarding your time. But when you're in practice, there's slightly a little bit more flexibility in case of time for private college, for private practice. So if you're doing medical college and private practice, then all your time is gone. Then you need to find some time for the family also. And for women, it's much more difficult. You need to manage. There's another component of it for women when it comes to in time management. Take help. Don't shy to take help. Your family's around. Divide the work. Even the household work you divide. And that's how it's going to. But there is a compromise somewhere. Yes, there will.
When did you first develop interest in IADVL and decided to become a part of the committee?
Honestly, didn't decide to become part of it. Then at a conference, I started off as joint secretary of Karnataka. Executive member of Karnataka IADVL immediately after my PG. So immediately after that, I attended the state conference and became EC member. Next year, I became joint secretary. And in Karnataka, I think up till recently, we had a ladder. So from joint secretary, they move on to the positions. Now we have elections, but till now we've had this ladder system. So that's how we came. And once you're there in the system, how we came to national IDVL, I don't know. Someday Dinesh and me just decided, let's contest. Treasurer, secretary, come on. Dinesh is my UG batchmate, so I've known Dinesh for more than 25. We've been friends for more than 25 years now. We said we'll just contest, and we started, we contested, and then we won. And once you're there in the system, it just goes on. So I was there, then I've been quiz master for, I think about 6 or 7 Cuticons. I've been the quiz master. Then parallelly, I was part of ACSI also, Academy, for 2 terms. For 4 years, I was in charge of ACSI Academy. So what I advise, when you finish and come, grab every opportunity which you get. You're young, you have much more energy at this time. Do not say no to any opportunity at that time. You get to speak in a conference, you get to give a talk somewhere, take it. Let your name become a little bit more familiar. Take every opportunity you get. Use every opportunity you get initially. After 5 or 6 years, then you get a choice to select and say no to some things. But at least in the initial years, I think just grab whatever comes your way. If that is what you want to do, if you want to be in an association, or if you want to be a faculty in conferences, and if you want to be known, then this is what you want to do. But if you think you're going to be happy doing your practice, you're going to be happy with your family, and you're going to be happy with that, that is also fine. Okay, don't compare yourself to others. Your success cannot be measured by others' success. End of the day, you need to be happy. You need to be satisfied with what you're doing. See, that is what is more important. Unless you're satisfied, if you're just being at home, spending some time gardening, reading books is going to give you satisfaction, do that. So stop, never compare your success with others. So what is good and what gives joy to others may not give joy to you. So make your own priorities, your own points, which is going to make you happy. If you feel being very busy and doing multiple tasks is going to make you happy, do that. If you feel you cannot manage, give up one by one. So, and to start something new, there is no age. Maybe you spend 10 years in a medical college and then you realize that's not working. So it's not late to start practice after that also. Okay? You can start fresh at any point, at any age. So, so this is what I would like to say. But one thing is grab every opportunity. If you want to be, if you want to be a faculty and be in that line, just grab every opportunity which comes your way, at least initially.
Thank you, ma'am. So we have a question from Dr. Vignesh here. How to bring international recognition to the great work being done in our country? Like most of the time, it goes unnoticed.
One is you need to get it published in an international journal, which has more readership. That is one. You need to present your work in an international conference. So that is how, from India, though there are so many people who are doing so much of work in India, very few people in India have an international name or recognition at an international level. So probably networking, attend 1 or 2 conferences, build your network and go on from there. If you want your work to go to an international level, you have to work for it. Nobody is going to sit back, search and say, okay, fine, this person is doing, let's get him to come forward. That's not going to happen. You have confidence in your work. You're doing a good work. Take it forward, send it, publish it, go send it as an abstract to international conferences. 1 or 2 places you do like that, you definitely get a recognition. People know there that you're doing this type of work, and then you start getting invited for that, and you start getting a name for that also.
Okay, thank you, ma'am. So another question from Dr. Vignesh is how to develop collaborations and teams in private practice.
This is a little tricky because it can work both ways. So you find like-minded people and then you start a combined practice, collaboration. As long as both parties are understanding, it works well. Otherwise, there are many instances where it has not worked and then people had to leave it. There are many instances where it has worked well also. So it depends also lots on the individual person. Initially, to start off with your practice, a collaboration is better. Probably you can work in 2 or 3 places that way. Then in one place, if you feel your practice has really picked up, then slowly you move out of it. And when you're doing a collaboration initially, even the financial part will be easier because you have more people investing into it. Otherwise, the whole investment has to be from your side. So basically, to find like-minded people, have everything on paper, have a certain set of rules, like this is how this partnership is going to work, or this is how it's going to be, so that there's no confusion later. Initially, everything will be very smooth, but once a lot of profits come in and once each person starts growing, that's when a little bit of kitch starts. So having everything initially discussed out, very clearly written out in paper, it'll be just like a proper corporate setup, and you can go. Don't say we'll do it on goodwill and start a partnership like that. Have it very professionally on paper. What's going to happen, how it's going to be. Then, just like any other job or thing, it goes forward.
Okay, ma'am. Ma'am, so there are some people working in a place where there is only medical dermatology. It may be some government hospitals or private hospitals. And suppose I want to start dermatosurgery over there, but I do not have any equipment. So how can I proceed step by step?
Okay. See, if you're in a college setup or even in a multi-specialty setup, for dermatosurgery practice, you don't have to invest much. You can always borrow the minor OT of the surgery people. Most of the instruments they have. For dermatosurgery as such, we need very, very basic instruments. For dermatosurgery, is more of skill-based. You need to have a training, attend a workshop, attend a live workshop, learn, and as long as you're confident to do the procedure, it should be fine. Your investment is going to be very less. And then probably for nail, we need some special instruments, which will cost you less than 4,000 or 5,000 in overall. And if you're doing vitiligo surgery, if you're doing epidermal cell suspension, then you need the kit, ECS kit. So that is what is going to cost you. Even for hair transplantation, your investment is not much. When you're doing like lengthy procedures, it's more of your skill. And what you invest once will stay for like if you buy a OT table, it's not for one case, it's going to be there throughout. So you can start with basic, and as you start doing more procedures, you get a separate space for dermatosurgery. So for dermatosurgery practice, what is more important is that you have a skill. Dermatology is a medical specialty. We are not taught how to suture also in in our dermatology residency.
Yes.
And during internship, what do? We do whatever we want. This whatever the surgery PG has taught us, or probably first year surgery PG, whatever they know they've taught us. So we don't know any of these skills from basic suturing skills. So we need to learn the skills first, and then we start the practice. At least the investment for dermatosurgery as such, if you're in a multi-speciality setup, is not much. They already have a OT. Definitely a procedure room is already there. So you don't have to spend much there.
Thank you for your overview, ma'am, about this. It was very important for, I think, most of us, I would say.
I would say most of you should learn to practice dermatosurgery and aesthetic because both of them, procedural dermatology has become a very integral part of clinical dermatology now. And instead of referring a patient, if you want to do a mole excision, instead of referring the patient to somebody else, it would be better if you can do the whole thing and complete the treatment. You have done the medical line of treatment. Why not you only do the surgical line of treatment? Why do you want to refer your patient the place? So, and these are just skills which comes with practice. They are not major surgical procedures. Things like flap surgeries, or those are like major ones. But all the other routine procedures can be done by everybody. You just need a very, very basic minimal training for it. So it's always better to know all of these things.
Thank you, ma'am. Thank you for telling us, so much about dermatosurgery and nails and IADVL. I think I was not much aware about all of these things. So, Kinnoor sir, would you like to add something here? Sir, I think you are mute.
Thank you, ma'am, for enlightening us regarding your journey, regarding the nails and all the procedural dermatology. And many people were aware of the fact. were unaware of the fact that many things exist in the field of dermatology. So, and thank you, ma'am, for joining us and
Thank you
enlightening
so much for
us.
having me here. It was good. It's my first live, Insta live.
Oh, sweet.
Ma'am, we're honored. That means the first Insta Live is with the residents of dermatology, and we would like to thank IADVL EC Rashmi ma'am, Dinesh sir, for allowing us to conduct such an enlightful session.
Thank you.
It was a
Thank you, ma'am.
pleasure having you with us, ma'am.
Thank you so much. Thank you. I enjoyed it. Thank you so much for having me here.
Thank you for your time, ma'am.
Thank you, ma'am.
Thank you.
Ma'am.
Bye. Good night. Good night,
Good night.
everyone.
Good night.
Good night, ma'am.